Today we have our CEO, Carmel Angelo, and our health officer, Dr. Doohan, here to provide you with a COVID update. So first we'll have Carmel Angelo, followed by health officer, Dr. Doohan, and then we'll go to questions from the media.
Okay, well, good morning. And Sarah, I trust you'll let me know if there's any problems with my volume. This is one of the few times that I am actually joining the Zoom from my home rather than my office. I am following health officer orders to the T. I am currently at home in quarantine. I've had my COVID test. It's my first COVID test in quarantine, but my third test. I am testing every 2 weeks, which we are recommending to our healthcare providers, our first responders, and those who believe that they're out enough where they should be tested every 2 weeks. So we're doing everything we can within county government to support the health officer orders. So thank you for joining us today. And again, this is our Friday update. We're very pleased that we could all come together and do a Friday update with you as often as possible. And again, we appreciate Dr. Doohan with her busy schedule, with everything she's doing for us, to also make the time. And that's because we recognize the importance and the important job that you all serve in getting the information out to the public. And we really appreciate when you get the information out quickly and accurately. So thank you. I think one of the questions that continues to come up, on a side note, but it does come up to us very often, is our search for a full-time health officer. We still have the health officer position posted. As you may know, if you go on the county website, you'll see it. We are still in a search for a full-time health officer. The good news is today that Dr. Doohan and myself have talked with one of our candidates who we think will most likely be joining us hopefully soon. We have a local physician who is very well known, has been in this community for quite some time, has served this community very well over the last few decades, and who is very interested in the health officer position. Again, this is a local physician and someone that is well known throughout Mendocino County and is highly regarded. And what we find, even though it's a difficult search finding a health officer, and that's in all 58 counties, what we know is that local heroes do show up, and they show up because this is a pandemic and because they're committed to the public's health. And so we have someone that we think will make an excellent health officer working with Dr. Doohan. And also we have a deputy health officer that I will talk about here briefly. But we plan on bringing this person to the board on July 21st. And for those of you that understand the county hiring process, depending on the position, this would be a closed session item with our Board of Supervisors on Tuesday, July 21st, and it would be appointment of health officer. And so our hope is that we can do that on the 21st at noon with the board. So that's the latest update on the health officer position. I have heard rumors out there that Mendocino County has already hired a health officer and that we haven't told anybody. Well, we have a health officer. That is Dr. Noemi Doohan, who has been working for us for some time now. We did hire a deputy health officer, and this is Dr. Molly Sharon. And we brought Dr. Sharon on a short-term contract to assist us with communicable disease. And some of you may have met her already in meetings. She has been working in the Department Operations Center. She's been working in communicable disease. And she lends a great deal to our CD team. She really likes to look at organizational processes and try to improve those. And she's been working with our team to improve our CD process. And she's been successful. So we appreciate all her work. And again, her name is Dr. Molly Sharon, and she has come on as a deputy health officer with Mendocino County on a short-term contract to help us with communicable disease. And at some point, you all will meet her. But right now we have her very busy with a lot of the projects that Dr. Doohan has assigned to her. So that's the health officer, the deputy health officer, and I have to say this one more time. Dr. Doohan is our health officer. She remains with us, and I have seen firsthand that she has not walked away from Mendocino County in this time of crisis. So thank you. So along with that, again, the people you see on this screen, Sarah Duquette, Dr. Doohan, myself, we're part of the team. We're not the whole team. We have a full team of county employees behind us that are doing a considerable amount of work. As you know, we still have OptumServe doing our surveillance testing. They are at the Redwood Empire Fairgrounds, and their hours are Tuesday through Saturday, 7 a.m. to 7 p.m. They do take a half an hour lunch from 12 to 12:30 and a half an hour dinner break from 5 to 5:30. And they also take appointments. You can walk in, but walk-ins are limited. And the reason for that is that there are so many appointments now and so many people that are going for testing that there is less space for walk-ins, though you still can walk in. I'm not going to give you the phone number right now because I don't have it at my fingertips, but Sarah could give it to you a little bit later. But again, you can go on the website, lhi.care, and register for a COVID-19 test. We also are doing testing throughout the county. And as Dr. Doohan has talked about multiple times, there are multiple different pieces or components to testing. So we have our surveillance testing in Ukiah here at the Redwood Empire Fairgrounds. And again, we have recognized community spread within Ukiah. So we have surveillance testing here in Ukiah, which we think is the best spot to catch it and to try to get in front of it. The ongoing testing that we do is in the outlying areas for outbreaks. So if we have an outbreak in any part of the county, we send a team to do testing, or we work within that community within Mendocino County to see if there are clinics or hospitals that can do the testing, and we work with them. And so we have had multiple days of testing of contacts throughout the county, and that persists and will persist. We also have a new contract with Consolidated Tribal Health to work with them to do testing on the 101 corridor. And so we have our team that is working with them at their locations up and down the 101 corridor. And we will be testing if we haven't done this already. I apologize, I don't have the dates. Some of the reporters may have the dates that I don't have, or Sarah may have them, but we are testing in Hopland, we have tested in Redwood Valley, and we are testing in the North County. Again, we test on tribal land in partnership with Consolidated Tribal Health. We send our staff, our team, to do the testing, and this is all on the 101 corridor. And again, the big area is the coastal area, and we have been asked repeatedly about having a OptumServe site on the coast. What we know in our research and working together and attempting to negotiate a contract with OptumServe is it is almost cost prohibitive to have an OptumServe site anywhere else in the county except the site that the state is paying for. And we know that the state will pay for OptumServe through the end of August. We're certainly hoping that that will be continued, but there's no guarantee right now. So we're making our testing numbers. I want to thank the public that is coming in and being tested. Thank you. Regarding contact tracing, that persists. Dr. Doohan will talk about numbers and all of that, so I don't want to get into that, but we continue to do our contact tracing. And then, of course, I believe Dr. Doohan will probably talk about masking and social distancing, so I won't get into that. But the last thing I would like to say before I turn it over is that the board did adopt an urgency ordinance on Wednesday of this week, which has to do with facial coverings and masking. And what that ordinance did is it turned a misdemeanor into an infraction and allows county staff to give tickets like a parking ticket if you're not wearing a mask. And the goal is really to expand the number and the type of employees that can do this, that can actually do the walking the streets having a presence and working with people, attempting to educate them on the importance of wearing a mask and the importance of not gathering. And if they see that, they can give tickets, or they can report that back to the larger enforcement team. So with that, I think I'll stop. I've taken up more time than I wanted to, and I will turn it over to Dr. Doohan, if that's okay.
Thank you, Carmel. Good morning, Mendocino County, and thank you to all of our journalists who play the important roles in this pandemic and making sure that we communicate with our public, which is a priority, absolutely a priority all the time, but especially during a pandemic, where with mitigation and containment, communication is of key importance to fighting this battle with the pandemic. I want to say how grateful I am that we have a full-time, local, highly experienced, highly regarded candidate for the health officer role, and that on July 21st, the Board of Supervisors who do employ the health officer will be considering this applicant. It gives me great hope that we have a local hero of this stature stepping forward for the full-time responsibility. We've been in this pandemic now for 6 months. It continues to be a rapidly evolving event. It is not slowing down, and we don't have the end in sight, but we are seeing it evolve as we have expected it would, based on fact and science and data. The good news is that in Mendocino County, as of today, we're doing well. We are holding the line, and we are really a firewall to the more fragile rural north, where there are other counties that have less resources than we do, and we are doing our part for our rural region. There's an article that came out in the Press Democrat today, Mary Callahan being the journalist, about Sonoma County going on the state watch list today. And so if you read that article, you'll see the details, which also are posted on the Sonoma County website, that has leading them to be on the watch list. When a county goes onto the watch list, the state can step in and actually impose backward movements in terms of the opening of that county. They can impose the sheltering in place orders to go backwards and be more limited. And Sarah will be sharing our data in a format that can be shared by our journalists, which we've compiled, that shows that we are not, at this time, as of today, close to being on the watch list. We have an average daily number of cases of 2.4. So for those of you who've been watching our data, we've been about having 1 or 2 cases now for some weeks, and we haven't seen it go from 2 to 4 to 8 to 16, which is what you see with exponential rise. We have been having a doubling time of 19 days. So that would be the amount of time going from 1 case a day to 2 cases a day. So it's a very, very good indicator that we are flattening the curve and slowing the spread due to what every single person in this county is doing, whether you're a business owner, whether you are an individual that is living here, or a healthcare worker, first responder, or even a tourist. The individuals in our county are doing their part, as evidenced by our data. In terms of our data, we have only 11% of our cases are over the age of 60. This is an indicator that can put one on the watch list if we start having more cases in the elderly population. This means we're protecting our elders. We are doing a good job of making sure our elders are staying safe from this disease. And also, our percent positive rate from testing is 0.8%, less than 1%. This is and that is in the setting of us doing widespread testing, and we continue to do this testing with OptumServe and all of the resources that Carmel Angelo spoke about. The UCSF free testing partnership. We have outbreak testing from the Richmond lab, and of course the hospital and our clinics do testing as well. So with all the testing that we do, we're holding the line at only a 0.8% positivity rate. But I say that is today, because one large-scale outbreak could change all of this. So we must continue to be vigilant, and we must continue to do everything that we're doing to keep our county safe. Our county is open in terms of our sheltering in place with every sector that can be open. There are some restrictions in the opening. So we have bar closure times that are earlier than bars would normally close. We have limitations on the number of hotel rooms that can be open for tourism, but nonetheless, all of our sectors are open. And that is because we're not on the watch list and because we are doing our part with mitigation. Mitigation includes social distancing, increased hygiene, staying home when you're sick, and wearing facial coverings in public, and medical masks in medical settings, and all of the other guidances that are in the orders. We have, in terms of our data, we have at this point officially been made aware of 108 cases in our county. Of those 108 COVID cases, 24 of them are current active cases on home isolation. When somebody is on home isolation, we monitor them daily through public health. And once they complete the isolation period, which is 10 days from the day their sample was collected for the COVID tests, then we count them as recovered as long as that they have improved. So in our county, we've had 108 cases in the 6 months of this pandemic, 24 of those being new on home isolation, and 80 people in quarantine at this time. Of our 108 cases, we have had no official deaths, and I want to explain why I say official. We have been committed on the part of our DOC to be transparent and accountable and to share all the information that we have when we have it. There is one death, and my condolences to the family of this beloved individual, this man, who died after having been admitted to Adventist Hospital, after having been stabilized in Adventist Hospital over a series of weeks of care, was transferred to a skilled nursing facility in another county, in Marin County. In that county, after weeks of care in that skilled nursing facility or rehab facility, this gentleman tragically did die. We do not have an official death certificate yet for this individual. So there is not public information about the cause of death. We have, as a county, been able to review some information that is available on a county-to-county basis, and it is possible, based on the death certificate, that there may be an underlying cause of COVID contributing to the death. But this is not an official document at this time. I will say that it is my expert opinion that this death will be attributed to underlying causes related to COVID, but it is not an official cause of death at this time. And again, this individual did not die in our county. So my condolences to the family who did share information on social media. And as again, we have not officially counted a death for our county, but I would say that I expect that we will have this one once there is further information. So we have 108 cases, no official deaths. I did find out today in an earlier call that it looks like we do have 2 new cases hospitalized at Adventist Health Hospital as of now. So this would be new information that's not on our tracker because we just received it this morning. So as I understand it, we do have 2 hospitalizations at this time, with 24 active cases in home isolation. We are very grateful to our clinics in our community for the partnership that they are providing us with surveillance testing, with, of course, all of the care that they, on an ongoing basis, give to our community, as well as the partnership they provide for their patients who are in isolation and quarantine, and as well the case investigation, contact tracing that these clinic partners provide in collaboration with the county. So I want to thank our clinic partners. I also want to thank our schools. We are in a very difficult time with our schools right now because we're looking for clearer guidance from the state about how our schools can safely reopen. And I have been advocating on behalf of our schools through the Rural Association of Northern California Health Officers, which is called Rancho. This is an organization that the rural health officers put together during this pandemic so that we could collaborate and coordinate it and actually advocate for our counties together at the state level. So the Rancho health officers and I, subgrouping of them, met over the weekend and have come up with a consensus statement that we're taking to the state about what we want to advocate for our schools to allow our schools to be able to open. And this consensus statement was shared with Michelle Hutchins, who's the school superintendent, and that will be distributed to all the school superintendents of the individual school districts. at a meeting that will be happening later today, as well as to our other school partners, the early education partners, the private schools and charter schools. And I'll just give an example of how I am advocating at the level of the state to allow our schools to safely reopen. For example, the state at this time says we must social distance 6 feet. So the Rancho health officers and I, hearing concerns from our schools, are advocating that the social distancing for children in schools will be from 3 to 6 feet, understanding that 6 feet social distancing in our classrooms would not be possible. So there will be more to come on that, but to assure you that this is an absolute priority for me as your health officer, the reopening of our schools, as is ongoing partnership with our schools, and I am taking this advocacy to the state, and we should have more information from the state in the coming week. Excuse me. There are also priority areas that have been of intense focus on the part of our DOC and myself as your health officer, and Carmel Angelo as our incident commander. One of these areas is the early release of prisoners onto parole from San Quentin, where there's an active outbreak of COVID. We are working within our county and within collaboration with CDCR to make sure that these parolees are arriving into our county in safe environments. And for example, we do know that we are having a parolee returning today, and this individual will be quarantined in a hotel because which the county will provide, because this individual, all of the parolees will be quarantined for 14 days if they have not already been quarantined in the correctional facility. So this individual will go straight into quarantine with monitoring by county health into a hotel today. So that's an example of how we are responding and working daily, day and night, to make sure that we don't have any introduction of the disease into our county without controlling it and mitigating the spread. Another area of intense focus has been with CAL FIRE. There was an outbreak in the Leggett station, and this was coordinated very closely with CAL FIRE, with our county, with our MOAC, and this was contained. Very strong response on the part of CAL FIRE to close that station, send everybody home. Thank you to all of our partners who facilitated testing, and that has been contained. So the fire station is now reopening, as far as I understand, after a 72-hour dark period to allow for deep cleaning. And we will continue to work very closely with CAL FIRE and with our fire partners as we enter more deeply into fire season. There also has been, I'm sure all of you are aware, announcements on the part of national and international organizations about the airborne spread of COVID. Well, we health officers knew that there was risks to airborne spread, and this is why we speak about meeting outside as to the extent possible for allowed reasons to meet. So if you have, for example, childcare, stable bubble, and you can have the children outside, that's safer. That is because we know that the droplets can linger in the air. And so opening windows, meeting outside, all of these things are protective. And this is why it's dangerous to, for example, work out in a facility in a closed room where there's other people working out. This would be something that I would do with extreme caution for anybody that might do such an activity, recognizing that the gyms are open at this time. Regarding another area of concern, we do know that with our 108 cases, we may have 2 more that we just heard about this morning. 52% of our cases are from the Latinx community, particularly from the monolingual Spanish-speaking community. And there's many things that we're doing at this time to give additional attention to our monolingual Spanish-speaking community. The clinics partners have been tremendous in their partnership with us for our testing and case investigation, contact tracing, communication being provided, as well as our journalists here, El Punto, our own George, who's been helping with interpretation and translation. But I also want to mention that we are going to be having a special meeting of the Board of Supervisors on July 21st from 3:30 to 5:30 to focus specifically on the Latinx community and COVID. Finally, I do want to announce that there are new orders coming out today. These orders are focusing on the blanket isolation and quarantine orders, as well as on medical masking. So this is more focused perhaps on our medical community and what happens if you are tested positive. But you can find those orders on our website, but I do want to call out for you that regarding quarantine, if you are a close contact of a known case, you are ordered by the blanket orders of the health officer to be in quarantine. That is a 14-day quarantine. And these new orders will specify that the recommendation is to be tested soon after your quarantine period ends to the extent possible, for example, on day 15. The reason I do not recommend testing during the quarantine period is that this virus has an incubation period of 14 days. That's why we have a 14-day incubation period. So if someone in quarantine tested negative on day 3, they still need to quarantine because they could test positive on day 11 or 12 or 13. So for quarantine individuals, the recommendation is to remain, obviously that's the order, at home for 14 days and test as soon as you can after the 14 days is up. Now, we do have exceptions to quarantine. This is specifically for people that must return to work because they are a critical infrastructure worker. And these critical infrastructure workers are outlined in my new quarantine orders. This is a controversy at the state level about who and who are not critical infrastructure workers. I say it's a controversy because there are questions about different individuals thinking they might be a critical infrastructure worker when in fact they are not. So a critical infrastructure worker is outlined in my orders, my new quarantine orders. And for these individuals, let's say a doctor at the hospital when there is nobody who can replace that doctor for the work the very next day. That doctor might have had an exposure to COVID-19 that would normally place them in quarantine, but based on this exception, they could continue to work during the quarantine period as long as they have no one that can replace them, are asymptomatic, have symptom screening every day, wear a medical grade mask, and socially distance to the extent possible, and do not enter congregate settings like skilled nursing facilities. So you can find these details in the new quarantine orders, but I do want to give this message to the general public that if you are ordered into quarantine, you must stay home for 14 days. If you've had a close contact with a case, a close contact is defined as being within 6 feet. I define it as greater than 10 minutes. There are some counties that define it for greater than 15 minutes. Essentially, it's close contact for greater than 6 feet, for greater than 10 minutes in my orders, and you must stay home for 14 days, and you will not be going to work unless you have been informed you're a critical infrastructure worker, like a first responder, public safety. So with that, I will hand it back to you, Sarah, and we can enter into our Q&A period. Thank you.
Thank you, Dr. Doohan. First up, we have Matt from KMed.
Hi, Dr. Doohan.
Hi.
Thanks for being here. The first question I have is regarding the facial covering ordinance passed by the Board.
Oh, we just lost you.
We will go ahead and bring in Adrian Bowman from the Mendo Voice, and then we'll attempt to get Matt back on the line. Adrian?
Hi, did you lose Matt?
Yes, we'll get him back on the line shortly. Go forward with your questions.
Okay. Well, thank you, Dr. Doohan, for doing this again. I was wondering if you could elaborate a bit on the timeline. And you said you expect the death in Marin County to be attributed to COVID, in your expert opinion. I was wondering if you could elaborate a bit on why that is and what the timeline for that might be, and why there's the delay. There's a lot of people with a lot of questions about that delay.
Yes, so that delay is because the death certificate for Marin County was, as I understand it, was put into the case is being investigated. And I think that regarding the underlying causes of death. So in Marin County. So I mean, I can just say that if a previously healthy person dies from complications of respiratory problems after they've had COVID, there could be the assumption that that was related to COVID. but we just don't have enough information yet. But it's somebody previously who didn't have serious respiratory problems, and then, a month, 6 weeks after they had COVID, they did. In my expert opinion, that is going to be related to an underlying cause, likely, of COVID. But again, we don't have a final death certificate, and that's why I cannot attribute it. And that would be really, the information is in Marin County, because that is where the individual died.
And my second, thank you, Dr. Doohan. My second question is for CEO Angelo. In terms of the masking infraction status now, are you hiring on additional staff? Are you giving additional staff training? Are you planning on rotating staff in ways to issue those infraction citations? Or is it kind of just if the building inspector happens to be somewhere, they can do it?
Well, thank you for the question. I did have a brief meeting with Sheriff Kendall and our code enforcement officer, Trent Taylor, and also John Martyr, who runs our special investigations unit, for this very purpose, to begin the dialogue as to what exactly do we need to move forward with the urgency ordinance. And the purpose, including me in the ordinance, was that not only Dr. Doohan, but then myself, we could then go ahead and hire either outside contractors or designate county staff to work on the infraction process. So to answer your question, yes, I am looking at utilizing additional staff to assist the sheriff and John Martyr in this process. And if we determine that staff are just stretched too thin, then we will look at utilizing a contractor, and so essentially contracted staff. Another option for us, Adrian, that some of the supervisors really like, and I think that it's something that Dr. Doohan and I both really support, is the possibility of having what we would call like community service workers or community service volunteers who would actually be out in some of the areas, say like the town of Mendocino and some other areas, and they would just have a presence and basically try to educate people and, very nicely say, hey, you need to wear your mask or no gathering. So we've got some plans in the works. I do envision we will either be assigning additional staff to this process along with John Martyr and the sheriff, or we will be hiring contracted staff.
So that latter option of community service workers or volunteers, that would be sort of like volunteers from the Mendocino community. My understanding is there appears to have been a particular difficulty there with this issue. From the Mendocino community who are deputized as sort of like a mask meter maid type thing.
Yeah, it's something similar. We haven't fully vetted the idea. I mean, there's a lot of options. I mean, that's the one thing when you start really looking at, what exactly is needed and how do we get there, then you come up with a lot more options. So yes, what you're thinking, that's an option for us. The challenge, I think, and this is something that, I will not move on unless Dr. Doohan agrees with, the challenge is usually with community service workers, volunteers. It's usually people who are retired, who, want to do something with their time and want to do a little more. And when you're talking about working out in the community and trying to educate people on masking, I'm not certain that we want to use our retirees. So it's a challenge as far as what the best population is, who's available, who wants to do this. But you're thinking along the same lines we're thinking. Thank you.
And real quick, what would the timeline be on that? On when you would roll this out?
Well, the timeline should be yesterday, but the timeline will be as soon as we have enough time to talk about it and schedule it. And so I've had one meeting with our sheriff and again, as I said, SIU and code enforcement, and we have another meeting scheduled next week, which I hope we can firm up a better plan. I also spoke with John Martyr a second time, and he is the lead. All of the complaints around enforcement come into the special investigations unit, and they go to John Martyr and his team, and then they get triaged out. So I am working with Mr. Martyr to see exactly what they need. And we will be bringing a contract forward to the board on the 21st, I believe, that will provide more contracted security to help with isolation and quarantine. And so we are looking at that contract to see if we want to augment that contract for this very purpose. So I would say within the next month, if not sooner, we will have something rolled out. And again, my role, enforcement, is not under the CEO. I want to be very clear with that. I would never get in the way of Sheriff Kendall and his men. Enforcement is still something that is a much larger picture. My only role is attempting to provide more resources to our enforcement team. Thank you.
Thank you very much.
Thank you, Adrian. And we have Matt from Kima back on the line.
Hey, thank you. Sorry for the tech glitches. Am I coming in clear?
Yes.
Okay, Dr. Doohan, good morning. So my first question is regarding the ordinance passed by the Board of Supervisors to issue fines to those not utilizing facial coverings. I'm curious what your reaction is to this from a public health standpoint. How is this a step in the right direction? And kind of my second corollary to that is I've been contacted by some residents who in good faith are concerned that their medical exemptions would not be understood or respected. And I'm wondering what you, being our public health officer, would say to those individuals, how they would navigate this ordinance.
Yeah. Well, thank you. Carmel, Angelo, I'm not sure, Matt, if you were able to hear that Adrian, your colleague, asked about the ordinance of Carmel, Angelo, who gave a response about some of the background to it. But regarding, yes, I mean, this is a great follow-up question. I did earlier mention that there is a really excellent article in the Press Democrat by journalist Mary Callahan, I believe it was yesterday or maybe today, about how Sonoma County is going on the watch list. And if you read that article, it does reference our ordinance. And there's a quote from Carmel Angelo in that article. And it actually states that in Sonoma County, they're now, that they're on the watch list, are taking a deeper look at how can they help, what can they do regarding enforcement. For health officers across the state of California, enforcement remains one of our greatest concerns, because I can have an excellent facial covering order, which I do, but if nobody follows it, it's not no better than the paper, that it can be printed on. And we do rely on the people in our county to follow these orders. We do rely on our tourism businesses, like who are our ambassadors to tourists, to tell them to follow these orders. But ultimately, we know there are some people that are not following the orders. And so having a way to enforce that is something that gives us much greater power with one of our most effective tools in this pandemic, which is facial coverings. One of the things I want to mention here is that if you're wearing a mask and it's below your nose, you're not wearing a mask. The mask must cover your nose and mouth. There's no benefit to just having it over your mouth. We sample people to see if they're COVID positive by sticking a swab up their nose. So if their nose is not covered, that you are doing nothing. You might as well not wear the mask. So I do think that perhaps this ordinance will allow us to give more directed education to people, to say, like, if we have these community outreach individuals that Carmel Angelo spoke about, if they're outside and they're wearing a facial covering and they're 6 feet away, I think that's a good environment to be safe. But if they can say, hey, sir, could you pull that mask up over your nose? That might just be the education and the instruction that people need to properly wear a mask. I do see people wearing their masks just around their necks, around their mouth, and so on. Now, regarding somebody that has a medical exemption, I would tell them that there is actually, in my order, the ability to wear a visor. I know that the governor has put that it is a visor that should be with a drape. But my reading of the governor's order for masking, we have a state order for masking as well as a county order for masking. The state order says that you can, instead of wearing a facial covering, you can wear a visor with a drape. But my order doesn't say visor with a drape, because as County Council and I read the state orders, we really believe that what the intention is that the visor should completely cover the face, including the chin, the whole face, including when the person is talking. And the reason I did that is from being out that I have been in Mendocino County, have not seen anyone wearing a visor with a drape. So I'm not sure where they would get one of these visors with drapes, but I have seen many people wearing visors. So what I would say is if you have some reason why you can't wear a facial covering, please do wear a visor. Because I can't really think of any reason that someone would not be able to wear a visor. Now, there may be people that have to have oxygen on. For those individuals, I would say that I'm particularly concerned about you. With COVID, I would hope that you would find a way to have protection for yourself. And so, in terms of medical exceptions that someone wouldn't wear a visor or a facial covering, I think there's going to be fewer of those. But for that individual, I think they would just explain what their medical exception is, and that should be sufficient.
Thank you for addressing that question, Dr. Doohan. My second question has to do with the California State Prisoner release. As you know, we have, I believe it's 11 state prisoners coming to Mendocino County right now. One of those, as you stated, is coming from San Quentin, which currently has over 1,500 cases. Humboldt County released a statement, Sheriff Kendall released a statement regarding this influx of prisoners, and there's concerns that they've associated with this release about sort of being an unfunded mandate on probation, law enforcement. And I'm kind of curious from a public health standpoint, what issues you see in these inmates coming into the county, what resources the state has provided the public health contingent of Mendocino County to support the integration of the inmates, and just maybe in general, what are some of your concerns with this movement?
Yeah, very important question. And I'd like to start it off and then ask Carmel Angelo if she'd like to make any comments regarding the funding piece, because that's what she knows, and I'm not an expert in that area. But I do want to give the background that as a family doctor, a full scope family doctor who practices, in clinic and hospital as well as public health, in my background, I have worked in the California Department of Corrections. I did work in Avenal Prison, and it was probably 8 or 9 years ago now. I'm very familiar with the conditions in the prisons. And also, I started the street medicine program for Adventist Health, and I'm very familiar with the actions between the homeless populations and individuals who are released from prison. So when somebody is released from a prison, if they don't have a home to go to, they're released generally to the county where they were arrested or where they did the crime. And then they go into prison. If they're released back to that county on parole and they don't have a place to live, they often enter the homeless population, the people experiencing homelessness. So with street medicine programs, we often would find people who've been paroled from prison. So thinking about this, I did advise Carmel Angelo and our team that we needed to have a housing readily available for these individuals once they have been paroled. Now, these are people that have served their time and have been released on parole. So for example, this one individual who's arriving today, we have a motel room ready for them. And that is part of our strategy to prepare ourselves. That's not to say that all people being paroled from prison are homeless, but it is a reality. It is a reality. So we are prepared in that sense. Every individual who's being paroled to us, hopefully we get the information in advance. I say hopefully because sometimes we don't. But when we get the information, we immediately respond to it. And we make sure that that person is in quarantine for 14 days if they have not already quarantined in the prison system. So a couple weeks back when we were getting parolees, let's say from Chino, where there was an outbreak, we were finding that they were doing their quarantine at the prison. There was one case a couple months ago that we got from Chino that didn't quarantine at the prison, that we did it again in a hotel room. We provided the quarantine. But the bottom line is individuals will be quarantined coming out of the prison system for 14 days if they are having an outbreak in that prison. We are receiving parolees from San Quentin, so those individuals will be quarantined for 14 days, either in their home or in a hotel, and we will provide active daily public health monitoring to make sure that they safely achieve their quarantine period of 14 days. Carmel, did you want to comment on the funding piece?
Sure. Actually, can you hear me? I'm off of mute,
Yes.
Sarah? Okay, great, thank you. 3 things I want to say about this. One is that, I do want to give another plug for Senator McGuire, who has been right there assisting us. I called him a few nights ago and said, we're really concerned. We have these inmates that will be coming into the county. We don't have a list. We don't know when they're coming. We don't know anything. And we want to catch them when they first get to the county, under Dr. Doohan's direction, so that we can quarantine them and make sure that we don't have someone knowingly coming into the county that is possibly exposed or is a positive COVID. And Senator McGuire, the next day we had a meeting scheduled with CDCR. So I do want to thank Senator McGuire. For those of you that don't work with him and don't know him, I can tell you he is our biggest champion, along with Assemblymember Wood. I don't want to leave out Congressman Huffman, but I can call Mike McGuire any time of the day or night, and he's right here for Mendocino County. Regarding the money, a very dramatic statement is, what's the cost of a human life? Because when you talk about spending money to isolate 11 people for 14 days in a hotel, making sure they get their meals, they have everything they need, but that they stay planted so that if by some chance they've been exposed or they're positive for COVID, they don't spread it to anybody else. That is a cost that we will incur in order to keep the public safe. I don't know what that cost will be right now, and I don't know that we have to quarantine 11 people in a hotel, but we're ready to do that. I cannot tell you whether outside funding will be available or not. We have CARES Act funding, we have FEMA funding, and we certainly will bill appropriately because the general fund is always the payer of last resort. So I can't tell you what funding we will bill against right now, but I know that we will, because we've talked about this. Additionally, there is some hope that there might be some state funding. I mean, Sheriff Kendall is spot on with this, and Probation Chief Locatelli, we have been working with both of them identifying the early release and the others that are coming in from San Quentin and some of the other facilities. And so, so here we go, whether it's an unfunded mandate or not, we know we have to do it. We will bill against every funding stream, outside funding stream that we can. But in the end, if the general fund has to pay, the general fund will pay, because it's more important to make sure these people are quarantined. And the last thing I would say, because I have a lot to say about this and I think about it a lot, I don't understand the logic with taking a high-risk population and putting them out into the state, into all the different counties that may or may not have the resources to protect the public, when you intentionally are bringing high-risk people back into these communities. I don't understand the logic. Thank you for allowing me to say that.
I appreciate your candor. Thank you for taking my questions.
Thank you, Matt. Next up, we have Sarah from KZYX.
Hello, can you hear me?
Yes.
Okay. Well, I would like to follow up on Matt's question, and it's probably another intersection of huge responsibilities and unfunded mandates. But we learned this week that Project Room Key is winding down, and we've terminated over 70 rooms so that only symptomatic homeless people are eligible. And of course, that was a state-funded program. And we also just learned about our first case associated with a homeless shelter, although it wasn't someone in our local homeless population. And I'm wondering if there is another program in the works to try to keep homeless people off of the streets before we have a more significant spread in that population.
Carmel, do you want to,
I just have one statement to make, which is, Sarah, everything you said is correct. And we have key staff. I'm going to thank Megan Van Zant, who's been instrumental in assessing our homeless population and getting them into hotel rooms. And of course, Tammy Moss Chandler, who is the director of the agency, who has been throwing herself into this fully to assist. We know that there's been a change in the funding requirements and we have to comply with those changes. But I can tell you that staff has been doing everything they can not to return people to the street, to their life of homelessness, and really trying to get everyone placed somewhere. So I can't tell you if there's another funding stream right now, but what I can tell you is if there is, we'll find it. Mimi?
Yeah, and also to say, you know, I'm very grateful that Building Bridges has kept their shelter open, right? So normally we see the shelter close. It's a seasonal shelter, and it is still open as a homeless shelter beyond the normal season. So that is also a resource that we wouldn't normally have at this time of year, which we do continue to have. We also do have our alternate care sites, which are Whitmore Lane is one that we've spoken about, where we can provide housing for people who are, you know, needing to be in isolation or quarantine that do not otherwise have a home they can stay in, which might be because they're experiencing homelessness, or it might be because they live in conditions where they're not able to have their own bedroom and their own bathroom if they're in isolation. So we do have that resource that we are standing ready to use as soon as we need it.
And just a quick follow-up, I'm wondering if any of the rooms at Whitmore Lane facility are being used.
Not yet.
And my next question is, you mentioned that you would not recommend that people work out in a gym in a room where other people are working out. And I'm wondering if they're dangerous, why are they open?
Well, why are many things open? The reason that they're open is that we have to keep living our lives and that we can't lock down forever, right? So they opened because the governor opened up the higher risk business sector. And it was up to the health officers to be more restrictive than the governor at that point in time. So at that point in time, when the governor said that for those counties, the variance counties, which we are a variance county, in other words, we met all of the metrics and we very rapidly, within days, submitted our paperwork for variance attestation. Moments after it was announced, we started working on that. So since we became a variance county, because we've been able to slow the spread and flatten the curve, we have been able to open up our higher risk sectors because the governor allowed it. And I made the choice as the health officer to allow us to open up to the extent possible at that point in time that the governor allowed. So we are doing okay at this time. I have not had any case that is related to an outbreak in a gym. And so therefore, I feel confident that we can continue to keep our gyms open. And I know that's because the owners of our gyms and those businesses must be doing a good job. I'm hearing some background noise from someone who might want to mute. And they're doing a good job. Thank you. So if there were to be an outbreak in a gym, that might change my attitude about this. But for now, we haven't had one, and the governor allows the sector to be open, so I am allowing it. I will say that if we did come close to being on the watch list, which we are not at this time, this would be a time when I would be looking at the higher risk business sector, which includes gyms, bars, it includes lodging for tourism. We would be looking at these sectors to look at, have they had outbreaks? What are their practices? Ask for them to have their certification plans reviewed, their safety plans reviewed, and then I might consider action at this time. But at this time, I don't see any red flags connected to gyms in our particular county.
Thank you, Sarah. Next up, we have El Punto. We have Jackie on the line, and we have George for translation.
Hi, good morning. Thank you, Sarah. La primera pregunta es, algunas personas se rehúsan a utilizar los cubrebocas porque han leído que en las redes sociales que a largo plazo el uso de ellos tiene consecuencias y enfermedades. ¿Qué nos pudiera decir acerca de esto, doctora Doohan?
George, you're on mute.
Yep.
Yeah.
Okay, good morning. There are people who refuse to use the face mask because they have read on social media the long-term use of them has consequences on illnesses. What can you tell us about this?
Well, I can tell you that as a doctor, when I'm in doing my job in hospital, I wear masks all day long. And all of us doctors, all of us healthcare workers are wearing them up to 24 hours straight. And we have not seen any negative consequences from wearing masks in the healthcare workers. So it is saving lives, and there is no truth to the idea that wearing a mask hurts the wearer. There's no fact, no science to support this. In fact, wearing the mask is saving lives.
Ok. La doctora Doohan explica que ella como doctora, viendo pacientes, ha tenido que usar una máscara que le proteja la nariz y la boca casi todo el día. Y no solo ella, sino todos los médicos en un hospital tienen que estar bajo las mismas condiciones. Y no ha visto en ninguno de ellos alguna consecuencia médica o algún problema de salud que les haya afectado por el uso de una mascarilla por largo tiempo. Se ha demostrado que esto salva vidas y es una buena medida preventiva para poder evitar que este virus se siga expandiendo en la comunidad.
La segunda pregunta es si el condado tiene considerado extender el horario del servicio del Centro de Atención Telefónica del COVID-19, porque algunas personas han llamado después del horario o durante el fin de semana y no han encontrado una persona que hable español.
Okay. Is the county considering extending the hours of the COVID-19 call center? People who have called after hours or during the weekend have not found staff who speak Spanish.
I would say this would be a priority for us to have Spanish speakers, but I do know that the call center is not open on the weekend. I don't know if Carmel or Sarah, you can answer that, but I thank you for that feedback, and it is a priority for us. That's what I can say. But any comment on that?
Well, one, you're right. The call center is Monday through Friday now, and calls go to dispatch. And I believe that we do have Spanish-speaking dispatch workers, but I can't swear to that. And I know that that is an area of need and an area that we've asked for assistance in. We actually did a mutual aid request to the state where we've asked for 6 bilingual contact tracers, which would be people that would be speaking with community members. And additionally, we're always looking for additional bilingual staff for the call center. One of the goals of the July 21st workshop that Dr. Doohan and Chair Hashtag are arranging with the Latinx community is to ask for assistance as well with bilingual speakers. And I don't know if Sarah, who actually has great involvement with the call center, has anything to add.
We can definitely follow up with dispatch. I believe there's always one person in dispatch trained to take call center calls on the weekend, but we can touch base with them about having a Spanish-speaking dispatcher available as well.
I would like to know if the call center on weekends is able to take voicemail messages.
The call center rolls over to dispatch, so it gets picked up, but they can also email the call center, but it gets rolled over to the dispatch.
Okay. Ok, bueno, respondiendo a la pregunta, el horario de este central telefónica para el COVID-19 es de lunes a viernes hasta las 5, de 8 a 5 de la tarde. Los fines de semana eso está cerrado. Sin embargo, es una prioridad para el condado siempre contar con una persona que hable español para poder atender la llamada de todos los usuarios y poder orientarlos. Se está evaluando la posibilidad de poder contar aún más con personal bilingüe no solamente para el call center o para la central telefónica, sino también para el área de hacer los investigadores de casos o los que hacen seguimiento de casos por el volumen de hispanos que están siendo afectados por esta pandemia.
Gracias, George. Gracias, doctora Doohan.
And before we, thank you. And before we finish, Carmel, could you say something about some more detail about the special session of the Board of Supervisors with Supervisor Haschek and myself on July 21st from 3:30 to 5:30, focusing on the Latinx community, just so that we can share that specifically with El Punto?
Thank you, Dr. Doohan. Thank you. Yes. Supervisor John Haschak, if you're not aware, had scheduled a board session with our Latinx partners some time ago, actually before we got hit with COVID. And the goal was so that members of the community could come forward, speak with the board, and have an open dialogue about some of the issues within the Latinx community, so that the board would have greater awareness and we could look at focusing county resources and services more so on this community. We got hit pretty hard with COVID, as everyone knows, and so many of the workshops that we had scheduled were put on the back burner. Most recently, Dr. Doohan has been very much focused on working with the Latinx community and the concern of the COVID spread within the community, within all of Mendocino County, but particularly how we outreach to the Latinx community, educate the community, and have more inroads so we could work closer. And so between Supervisor Haschak and Dr. Doohan, they have given direction that we schedule a workshop, with the purpose of the workshop being that Dr. Doohan will talk about COVID and the impact of COVID in Mendocino County, and particularly the Latinx community. And then we will hear from our community partners, some of them being some of the people on this call. We have asked Rosanna Barra actually to work with Dr. Doohan, yes, but Supervisor Haschak in particular to get a panel of people who could speak to the board publicly during this workshop, and that together the issues could be identified and the greater solutions as to how we outreach to this community and serve this community in light of COVID and the impact of COVID. So, excuse me, so that is the goal of the workshop. Again, as Dr. Doohan said, that workshop is scheduled from 3:30 to 5:30 on Tuesday, July 21st. And as we speak this morning, Supervisor Haschak and Tammy Moss Chandler and Rosanna Barra were having their first meeting, trying to schedule a greater agenda for those 2 hours and looking at who would be joining us. And then, of course, Dr. Doohan will give her input as to how she wants to see this. And Dr. Doohan and Supervisor Haschak have already talked, so more to come. But you should be hearing, George and Jackie, you should be hearing more about this either from Rosanna Barra or from county clerk staff to schedule you for July 21st to join us.
Okay. Okay. Hay una sesión especial programada por el Board Supervisors o el Consejo del Condado que va a ser llevada a cabo el día martes 31 de julio a las 3:30. Esta es una sesión especial en la cual se va a invitar a miembros de la comunidad, a líderes y a la comunidad en general para poder identificar problemas que están aconteciendo específicamente en la comunidad hispana. La idea es poder identificar estos problemas y poder plantear algunas soluciones de manera conjunta. con las diferentes organizaciones de la comunidad y poder, digamos, establecer algunos mecanismos de poder llegar mejor a la comunidad hispana, de poder educar de mejor manera a la comunidad hispana y también identificar de qué manera se está impactando esta pandemia más en la comunidad hispana. Entonces, sería bueno esto, difundirlo a través del periódico Al Punto, y que la mayoría de las personas o un buen número de personas puedan estar presentes para poder nosotros expresar nuestra voz, nuestra preocupación y también involucrarnos en la solución a controlar esta pandemia aquí en Mendocino, en el condado de Mendocino.
Esta sesión del board va a estar abierta para el público en general o solamente va a ser por invitación a ciertas personas de la comunidad latina?
Okay, this special session for the board supervisors on July the 31st is just by invitation or is open to the community?
I'd like to ask if Carmel, I see she's gone off video.
Yeah, no, I'm still here. I just, sorry, I was on mute. Oh, no, it is a public session. And again, as we speak, there's a group that is putting together the agenda. So if you are someone who wants to speak, that's at the workshop, to watch the workshop, participate, speak, I would say you could contact our clerk of the board staff or Supervisor Hashjack or Tammy Moss Chandler, and certainly become a part of that. I know that we wanted to have a group of community members speaking. So clearly, if you want to participate, you could contact the county and absolutely participate. Or if you're more comfortable contacting Rosanna Barra, if you know her, you can do that as well.
Bueno, es abierto para la comunidad en general, pero sin embargo, bajo los protocolos de del distanciamiento social, se van a establecer algunos requisitos, se va a trabajar en una agenda para poder saber el número de personas que van a poder estar dentro de este auditorio y la idea es poder que personas que puedan expresar, canalizar el sentimiento de la comunidad puedan estar presentes en este día.
¿Y va a haber traducción en español o solamente va a ser en inglés?
Yeah.
Yes.
Yes, translation into español. Sí.
Okay, muchas gracias.
De nada.
Okay, thank you.
Thank you.
Thank you everyone for joining us for this Friday update. Before we let you go, we will be updating our dashboard later today with the new data talked about during this briefing. In addition, if you live in the community of Hopland and Willits, we've partnered with Consolidated Tribal Health to offer free surveillance testing. Hopland is going on right now up until 11 a.m., corner of Highway 101 and Highway 175. If you live in the Willits area, tomorrow, July 11th, 8 a.m. to 11 a.m., Sherwood Valley Tribal Office is where the testing will be. And please remember to wear your facial covering when you arrive for the testing. With that, we hope you have a wonderful weekend.